Hi, this is Dr. Morazy with Minutes for Moms. This is going to be our fourth video in our series of 5 about your 2-month-old baby. Today we are going to talk about safety. Still, it is very, very important that illness is of your utmost concern, and fever is going to be the thing that you're going to follow till the baby is 12 weeks old, so that's 3 months old. Anything above 100.4, 100.4, taken rectally is still considered a fever, and that is something that you immediately will be calling your primary care provider if that's something that your baby has. So that's the first part of safety. The second that I review at the 2-month checkup is pet safety, and it's really more dog safety more than anything else. One thing that I recommend is that we start to feed the dog other than where the general commotion is. I mean the kitchen. And what I want you to do is I want you to start to feed the dog maybe in an isolated area, or you feed the dog and then pick the food up. And the reason why is when the baby's 9 months old and crawling and getting into everything, the last thing we want is the baby then crawling over to the dog dish while the dog is eating and then having the dog go after the baby. Even if you think that your dog, that there's no way would attack the baby, because when you are feeding your dog, you've taught the dog that you can put your hands in its mouth, you can put your head down by the food. There's a difference between the owner who has been the caretaker from the very, very beginning, going in and putting their hand in the food, and the baby who has now taken the number one place over them. That's really when they're going to have more of that trauma. So your big pet safety there is just feed the dog other than the general commotion, which is typically the kitchen. The third thing that you want to remember is the baby is now starting to kind of move. Remember that development you're doing here, so we're really starting to kind of get a little bit of that movement here. So the last thing you want is the baby up on that changing table, and if there's a wiggle or a quick move, to roll off that changing table or bed or anything for that matter. So you're going to start to have kind of a hand on the baby if they're put on any type of high surface, and you do your best not to walk away and leave the baby unattended, even if all you're doing is walking to go get a diaper wipe. And the fourth thing that I will talk about a little bit is sun safety. And the reason why is now that the baby's 2 months old, you now are comfortable. Things are going well. You are wanting to get outside if you live in a good area where the temperature is always nice, or it's the summertime. And so you're going to want to go for walks. You're going to want to go out and enjoy things. The most important thing is that the baby needs to avoid direct sunlight. So that's going to be the baby's shaded. The baby has, a hat on. The baby has something where we have that complete shade, so we're not getting any sun exposure. Now, if you look at sunscreen, the bottle of sunscreen says do not use under 6 months of age. Well, the reason why is it's a strong chemical and can irritate the skin, and your baby's skin is so thin that they can still burn despite using it. So that's kind of why. But the last thing I want you to do is do your best to keep that baby shaded, and you're somewhere and you can't keep that baby shaded, and you think, well, I can't put sunscreen on because it says 6 months of age. If you're out and you can't keep the baby shaded, put sunscreen on. You're going to just put a little bit on. So what will happen is the baby will have a hat on. That will protect the head. That will protect the face. The baby will have a t-shirt onesie on. So with that, that will protect the trunk. And really, if you have to use it, you're looking at the arms, you're looking at the legs. So I would rather you put sunscreen on, even though they say it's contraindicated. I'd rather you put sunscreen on than the baby get burnt. So those are probably your big 4 tips when it comes to safety for your 2-month-old baby. So I sure hope that gave you a lot of advice. And once again, I'm Dr. Morazy with Minutes for Moms. If you're new to my channel, please subscribe, and once again, give me a like. And of course, give me any comments for any future videos that you would like for me to cover. Now you know what I know. Until next time, thanks. Goodbye.